So we're going to talk a little bit about narcolepsy and hypersomnia, kind of the other side of the coin of insomnia. And hypersomnia is a challenge that a lot of people do experience and can be difficult to diagnose and difficult to manage at times. But I do think it's important for us to start out by talking about what exactly is hypersomnia, because it's oftentimes confused with things like fatigue. Right? Fatigue is a physical symptom of like slowness, sluggishness, being worn out, lethargic, where hypersomnia is more of a drive to sleep, right? So someone can be physically not fatigued, but sleepy, right? Or hypersomnolent. And when it comes to hypersomnia, it's almost like you have sleep noise, kind of like how people talk about things like food noise, for example. You have this voice, this thing that's always like, please sleep. And it can affect someone's ability to maintain alertness and wakefulness even during important times that they should be awake. The need for sleep can be incredibly difficult or sometimes just not possible to fight, and can result in things like lapses into drowsiness, lapses into sleep, attacks where someone essentially falls asleep without that sort of drifting off kind of experience, and can significantly impact someone's quality of life. I'm someone who lives with hypersomnia, and it is really challenging sometimes because you can have days where it's really difficult to focus, really difficult to, maintain that energy and that like mental energy, and difficult to, to be your best self, especially without treatment. So the way we classify hypersomnia, I'm going to focus in on narcolepsy and idiopathic hypersomnia. So we have type 1 and type 2 narcolepsy. Type 1 has what we call cataplexy. Type 2 does not. And then idiopathic hypersomnia is what it sounds like if something's idiopathic. We don't know. We can't figure out why it's happening to you, but it's clearly an issue that needs to be managed. And these are primary hypersomnias. We have Klein-Levin syndrome, which is a different thing that's treated a little bit differently. And then, of course, things like hypersomnia from other issues, right? Just like someone can be have insomnia, but they've self-imposed that due to, life stuff. And people can have hypersomnia for very similar reasons as well, or hypersomnia from medical conditions, substances, etc., right? So moving into the actual narcolepsy symptoms. So when we think about narcolepsy, there's certainly things that you probably think of just like people passing out randomly, which can happen. That's really called cataplexy. So if someone, especially when they feel very emotional, they might experience a sudden loss of muscle tone, and they basically slip into REM sleep. So individuals with narcolepsy seem to have this difficulty in maintaining that line. There's kind of a line in the sand between awake and not awake, and their brain doesn't transition through their sleep cycle appropriately. That can transition straight from awake to rapid eye movement sleep. And that obviously can be pretty challenging, right? And cataplexy can last moments to minutes, depending on the person, depending on what's going on for that individual. We also have that excessive daytime sleepiness. They can experience sleep paralysis, which is when your brain wakes up but your body hasn't. So, and some people will experience almost like a figure sitting on their chest almost. They call it sleep paralysis demon. We can also see what's called hypnagogic and hypnopompic hallucinations, where you have perceptual disturbances during that transition period between wake and sleep. So you wake up and you hear like weird voices or see things. And if you have that from time to time, that's not necessarily abnormal. So some people will occasionally have sleep paralysis or hallucinations, but wouldn't fit criteria for narcolepsy. It's just a classic symptom that individuals with narcolepsy are much more likely to experience. So when we compare with idiopathic hypersomnia versus narcolepsy 1 versus narcolepsy 2, these are the primary symptoms that we look at, right? Daytime sleepiness is the equalizing factor here. So every single individual that has one of these three diagnoses will experience excessive daytime sleepiness. Though some people have trouble falling asleep at night, and that kind of has other disruptions in their sleep, but they feel very sleepy during the day. Some individuals with type 1 will consistently have hallucinations and sleep paralysis, as well as that cataplexy. The cataplexy doesn't happen with the other kinds. Hallucinations and sleep paralysis can happen, but isn't as often in narcolepsy type 2 and idiopathic hypersomnia. Difficulty staying asleep. Our idiopathic hypersomnia individuals generally do not have difficulty staying asleep. They sleep and they can stay asleep, and like the world no longer exists to them, and they can sleep for 10 hours, 12 hours. Narcolepsy type 1 will typically be able to have refreshing naps, and naps are part of treatment. Not as often with narcolepsy type 2, and with idiopathic hypersomnia, it's kind of like playing roulette a little bit when it comes to naps with idiopathic hypersomnia. Sometimes they're refreshing and sometimes they're not. Narcolepsy type 1 typically doesn't have this, what we call sleep inertia or sleep drunkenness, where you wake up and it just takes a really long time for you to transition back into full wakefulness, where that's a classic symptom that we see with idiopathic hypersomnia, where someone wakes up and it takes a long time for them to really get going, and their brain kind of feels drunk, right? It can happen sometimes with narcolepsy type 2, but it truly is the signal that we see with idiopathic hypersomnia versus the other kinds. So what causes these things? Well, we don't really know. Narcolepsy type 1 does have a little bit more supportive data in terms of what seems to contribute to its presentation. So it is associated with orexin, as I mentioned before. So there are decreased levels of hypocretin and or also known as orexin in the CSF or cerebrospinal fluid. And it seems like there might be a destruction or a loss of neurons that are innervated by orexin. Could be an autoimmune or other type of immune-related change. And there is a genetic component. It's about 10%, so not super, super strong. There appears to be a genetic heritability with narcolepsy 2 as well, but we don't see as much of that decrease in hypocretin in the brain that we see classically with narcolepsy type 1. Idiopathic hypersomnia, There's theories that there's changes in sensitivity to GABA, changes in sensitivity and utilization of histamine, which is another wakefulness promoting chemical, norepinephrine, and a circadian rhythm disruptions, suggesting that perhaps people who experience idiopathic hypersomnia function on more of like a 25 or 26 hour clock versus a 24. It's really hard to know. And people can sometimes jump between these diagnoses because there is a lot of overlap. And the really only truly defining factor between idiopathic hypersomnia and the narcolepsies is presence of REM sleep inappropriately, particularly during like a nap test. So if you fall into REM sleep within 20 minutes of falling asleep, that's not normal. And that is the thing that makes people go, oh, that's narcolepsy. Okay. And of course, we see medications, sleep deprivation, mood disorders that can cause hypersomnia as well.